Good afternoon. My name is Rob Williams. I am honored to join you once again as your MC of today's Heroes in Action Ohio Awards event. Today we will recognize the accomplishments of nurses, physicians, and other healthcare providers and raise money supporting March of Dimes. Although the way we come together has changed, our dedication to fighting for all moms and babies is as strong as ever. The U.S. faces an urgent maternal and child health crisis that only intensified with the pandemic. Every 12 hours, a woman dies due to pregnancy-related complications. Additionally, 2 babies die each day, and these numbers are higher for moms and babies of color. March of Dimes works across the country to reduce the rising rates of preterm births and maternal and infant mortality and morbidity. They support families before, during, and after pregnancy so all moms and babies can get the best start. This represents one of Ohio's best opportunities to support March of Dimes. And on behalf of our servant leader sponsor, Nationwide Children's Hospital, we thank you for being a part of this event. Because of our partners and sponsors and people like you, March of Dimes helps every family get the best possible start. A healthy birth for every child is a worthwhile goal, and you can help make that a reality. I'd like to introduce you to the chair and chair emeritus of our event, Jane Miner and Ant Gunther. Under their leadership and with the guidance of an outstanding committee, we were able to bring this incredible event to you. Here's Jane.
Thank you, Rob. It is wonderful to see all of us gathered together today to recognize 85 years of March of Dimes and each of our collective healthcare heroes and what they do every day. It is our privilege to recognize our committee that has worked together with the March of Dimes to host this event today. Those names are going to be displayed for you below on a screen. I cannot thank them enough for their dedication and their time for this great purpose. This year, we again ask friends and family and colleagues to recognize healthcare heroes in the entire state of Ohio, to recognize their work for inspiring and going above and beyond for our parents, for our children, and for the kids and newborns in this state. Healthcare professionals touch so many lives each and every day. It's even more important today and the last couple years between our COVID virus and all the other respiratory viruses and other situations that yield the importance of healthcare team members. March of Dimes has provided a great platform to recognize extraordinary healthcare colleagues who play a vital role in our healthcare team. There are not enough opportunities to recognize individuals for what they do. This is just one beautiful moment to recognize the great care that is delivered in this state by exceptional healthcare providers. Thank you for your contribution to healthcare. Thank you for being a member of our great profession of nursing and all the other disciplines that help serve our patients and families. Take care and have a great new year.
Thank you, Jane, and rest of the executive leadership team. You helped make this a fantastic event, as have our corporate partners, which have joined the fight to improve the health of mom and baby. Now I'd like to acknowledge the amazing support of our sponsors. A special thanks to our servant leader sponsor, Nationwide Children's Hospital. Their support of March of Dimes and commitment to the Heroes in Action event is greatly appreciated. I'd also like to thank our ambassador partner sponsor, the Ohio State Wexner Medical Center and the Ohio State College of Nursing have made this afternoon a huge success. Also, thank you to our community champions, Ursuline College, Akron Children's Hospital, Cincinnati Children's Hospital Medical Center, Dayton Children's Hospital, and thank you to our media sponsor, Fox 19, WXIX Television. Thank you once again to all of our wonderful sponsors. You help make this a spectacular event as we come together to celebrate our healthcare heroes and fight for the health of all moms and babies. Now I'd like to introduce you to a very special guest and my friend, Tiffany Hallman, Executive Director of March of Dimes, Ohio, who would like to say a few words and to congratulate our finalists.
Hello, my name is Tiffany Hallman, and I'm the Executive Director for the state of Ohio for the March of Dimes. I am pleased to welcome you all to the 2022 Heroes in Action Awards ceremony. Healthcare workers apply their knowledgeable minds, skillful hands, and compassionate hearts to protect the well-being of strangers and ease our suffering. It's my honor to say thank you to all that have been nominated today. You are all heroes, and we love the opportunity to celebrate what you're doing within our communities in Ohio to make it a better place. Thank you, healthcare heroes.
Thanks, Tiffany, for the incredible work you and March of Dimes do to positively impact the lives of moms and babies here in Ohio. Okay, it's time to kick off our awards with the first category, Professional Development, and the top finalists are Nicole Bauer, Cleveland Clinic Mercy Hospital, Andrea Miller, St. Elizabeth, Andrew Smith, Genesis Hospital, Zanesville. It's my pleasure to announce from Cleveland Clinic Mercy Hospital, Nicole Bauer, as Healthcare Hero of the Year for Professional Development. Nicole was able to implement a new medication protocol with the help of physicians and nurse managers. She completed one-on-one training for all staff and saw 100% compliance. By training physicians and staff on the new process, along with the reason behind it, patient safety increased. Nicole is in her third year as a substitute nurse. Nicole, congratulations again. Now on to our Patient Care Award, 0 to 5 years. The top finalists are Allison Campbell, Dayton Children's Hospital, Julie Wheaton, Ohio Health Riverside Methodist Hospital, Mark Donnelly, Firelands Regional Medical Center. I am pleased to announce the winner of the Patient Care 0 to 5 years Hero of the Year is Allison Campbell. Allison went from a medical unit to the behavioral health unit, and her relationships with the medical doctors help bridge communication. Armed with the knowledge of what those attending were facing, Allison brought education and communication to the forefront to focus on the best possible care for her patients. Way to go, Allison. Next is our Patient Care Award, 6 to 19 years of service. There are so many incredible candidates, this was hard to narrow down, but the nominees are Sarah Mustaine, Dayton Children's Hospital, Holly Griffith, Fairfield Medical Center, Angela Emerson, UC Westchester Hospital, Don Irwin, Fairfield Medical Center, and Mallory Capretta, Akron Children's Hospital. And the award goes to Sarah Mustaine. Sarah recognizes the importance that all her patients are receiving and have ongoing access to excellent care. During her time with patients and their families, Sarah is always assessing to ensure she meets the specific needs of her patients and their families. Sarah feels fortunate to serve a diverse population, ensuring care is equitable for all, which is the standard. Thank you, Sarah, for helping to close the health equity gap. Next, we have Hero of the Year, Patient Care, 20 plus years. And the finalists are Tina Stanley, Cincinnati Children's Hospital Medical Center, Judy Oculi, Metro Health Medical, Sharice Lofton, Metro Health Medical, and Starla Flout, Adena Health System. And the award goes to Tina Stanley, Cincinnati Children's Hospital Medical Center. Now, Tina was responsible for creating the patient education brochure for the living donor population. In collaborating with other disciplines on the transplant team, she was able to provide printed education at a level that was appropriate for all groups, regardless of their background. Tina was also able to change all donor evaluations to be done on site and in one day. This not only increased patient satisfaction, but it also decreased the time from referral to presentation by 75%, ultimately resulting in more living donor transplants. Way to go, Tina. We're going to take a break from the awards, talk a little bit more about why we're here. Nobody knows more about that fight than our mission families. The Rex Road families represents the hundreds of thousands of families who know firsthand the importance of the work of March of Dimes. Let's watch their story now.
Ian and I always knew that we had wanted to start a family, and we'd been trying for a little while, so we were so excited in summer of 17 when we found out that I was pregnant. I went in for some standard screenings. The young ultrasound tech put the wand down, and she goes, "There's 3 babies in there." That was the, sort of the first day of the rest of our lives. I was at 24 weeks and 5 days at that point.
Yep.
At about 2 p.m., the doctor came in, decided to do a quick cervical check, and, takes off her gloves and is like, emergency room. Now, 2:17 p.m. when Eliza was born via emergency C-section with Ruthie and Henry shortly after.
We knew what this early birth meant in terms of just risks and likely outcomes.
All three kids had remarkably few complications at birth, other than just being incredibly small and needing oxygen support. Then after New Year's, we started trying to extubate and go to CPAP. Eliza and Henry, after a couple of false starts, successfully weaned to CPAP. But around that time, we found out that Ruthie, she started requiring a little more oxygen. X-ray showed us that she had developed pneumonia. Got a phone call in the middle of the night to come in, and we did, and they had determined that she was not going to make it. And so we kind of sat with her and held her together. It was the worst day of my life. And that was February 1st of 2018. March of 2018, we were able to wean Eliza off of oxygen completely, and Henry down to a very little amount, just in a nasal cannula. On March 16th of 2018, we got to bring Eliza home. Henry came home the following week on March 23rd. It was incredible. That feeling of taking them home and walking out of the hospital with them in their little bucket seats was just, walking on air. 2020, I found out I was pregnant again. We found out that the baby had never continued to grow. Like, it reached a certain point and did not grow anymore. And so that was pretty devastating. So we kept trying, and in the summer of 2021, I found out I was pregnant again. They discovered that I had had a placental abruption, and Maggie was born via emergency C-section. Ian did get to hold her. She was, she was about 4 pounds, 4 ounces.
Yeah.
And so, still small and scary, but compared to last time was a vastly different experience. So she ended up spending 2 months in the NICU. So today we have 3 very healthy kids running around the house. Eliza and Henry are in preschool. They have really stepped into the role of big brother and big sister, and they love helping take care of Maggie. They are all so strong and resilient. The mission of March of Dimes is so critical. Our family has received direct benefit from the research that March of Dimes has done with the use of surfactant on all 4 of our children. That was life-saving for them in the NICU. Being able to spend time home with my kids after they were born was so important. And especially when you go through something like we've been through, you need that time to heal, to grieve, to spend time with your family. Everyone deserves to be able to spend that time with their kids. Ruthie is still very much a part of our story and of our family. March of Dimes supports moms and babies in the most vulnerable points of their lives, especially when things don't go right. And being able to support March of Dimes, as Ian said, in order to support those families, makes a huge difference in people's lives.
We're at the point that defines why we're here today. Our sponsors and volunteers have all come together to help March of Dimes improve maternal and infant health and to protect the health of families through research, programs, and advocacy. Here's your chance to be a part of that movement. Each of us can join the fight to improve the health of every mom and baby. All of you joining virtually have the chance to support March of Dimes at different levels. With your help, March of Dimes can and will create a world in which every baby has an opportunity to thrive and every family has the best possible start. We want to make a special mention of a project we are very proud of in Ohio. The Better Starts for All program is a partnership between March of Dimes and Reckitt to bring prenatal care to women in maternity care deserts where women's health care is not readily available. One important part of our project is our Mom and Baby Mobile Health Center, which brings partners Adina and The Ohio State University to rural southeast counties, providing midwifery care, telehealth, and other services to women who live out there. Thanks to Reckitt for helping to support this important work. Now you have the ability to donate virtually. Simply hold your mobile device to the QR code and fill out your donation information. I know this is a huge ask, but who will help March of Dimes continue cutting-edge research? For a $1,000 donation, we can provide 4 moms-to-be access to our supportive pregnancy care program where they receive prenatal care, support, and education throughout their pregnancy, or comfort 100 families of babies in a NICU through educational materials and activities. For a $500 donation, we can provide 2,400 nurses in-person professional education, and for $250, we can provide COVID-19 PPE kits to 25 NICU families. And for a $100 donation, we can provide essential baby items such as a stroller or a pack and play for women who complete a prenatal education program. Thank you for all your generosity. You're helping March of Dimes provide resource and programs that help mom before, during, and after pregnancy, even when everything does not go according to plan. So thank you once again for all your generous donations to support March of Dimes and our mission. Now back to the awards. Our next category is the Rising Star Award, and the finalists are Jasmine Carr, Dayton Children's Hospital; Dorothy Rowe, Metro Health Medical Center; Ellen Miller, Cleveland Clinic, Medina Hospital. And the award goes to Jasmine Carr. She takes a kind and gentle but realistic approach with her patients and treats them like family, like one of her own. She ensures they are comfortable by giving them the information they need every step of the way. Now, Jasmine's goal is to leave 100% of her patients feeling like they're at home when they are in her care. She treats all patients as individuals and strives to make them feel heard and understood. Congratulations again, Jasmine. On to our next award, which is the Innovation Award, and the finalists are Jenna Hospodar, Akron Children's Hospital, St. Elizabeth Boardman; Jordy Spittler, Dayton Children's Hospital; Sharon Lethgo, Summa Health System, Akron City Hospital; Michael Ackerman, The Ohio State University College of Nursing. And the award goes to Jenna Hospodar. Jenna's priority is to spend time at the bedside with her nurses in order to make them feel supported in decisions made by her or the healthcare team in regards to the care of the infant. She spends time answering questions and explaining her thought process behind medical decision-making as it relates to evidence-based care. It is Jenna's hope that the nurses she has the privilege of working with know that they can reach out to her at any time. She's also been working to improve safe sleep practices in her unit in order to educate all families, regardless of socioeconomic status, in providing a safe environment for their infant at home. Jenna encourages breastfeeding and understands that as long as the infant is gaining weight and growing appropriately, strictly breastfeeding is more than acceptable. Congratulations, Jenna. Now on to our next category. This is our Research Award, and the finalists are Brittany Punches, Akron Children's Hospital; Alexa Darwin, Mercy Health Youngstown. And the award goes to Brittany Punches. Brittany was recently funded by NIDA with the 5-year Career Development Award for leveraging mixed methods research to investigate the cognitive factors that influence patients' decision to seek therapeutic opioids and use them if available, and begin to bridge the gap between research and practice by using study results to identify targets for future behavioral intervention, development, and optimization of shared decision-making interventions. Way to go, Brittany. Our next category is our Leadership Award, 0 to 5 years. And the finalists are Nevia Mason, Dayton Children's Hospital; Julie Hackney, Metro Health Medical Facility; Jenny Dietz, Upper Valley Medical Center. And the award goes to Nevia Mason. Congratulations. She believes in giving patients and their families the comfort in building trust with their care providers results in better patient outcomes. It decreases delays in patients being comfortable enough to open up about their health concerns. As an assistant nurse manager, she is also a member of our organization's Black Employee Resource Group. She joined to gain better understanding of how to be a well-rounded leader within our organization. It's also allowed her to work with other members on getting processes started within the organization that improve patient experiences. Congratulations, Nevia. Next, we have the Leadership Award, 5+ years, and the finalists are Lori Strassel, The Ohio State University Wexner Medical Center; Jessica Bell, Cincinnati Children's Hospital Medical Center; Mickey Johnson, Nationwide Children's Hospital, and the award goes to Mickey Johnson. In the U.S., about 3% of babies are born with a congenital birth defect. In Ohio, birth defects account for 19% of infant deaths. Advances in prenatal diagnostics and fetal therapies offer the opportunity to intervene with the procedure, allow the pregnancy to continue, and improve the outcome for the baby and, in some instances, the mother. In Mickey's current position, she is providing team leadership to add fetal intervention and scheduled cesarean section to her community within a freestanding pediatric facility. Currently, patients have to travel outside the region or the state to receive this life-saving care for their baby. Preparing for introducing these patients required meeting with key stakeholders from many disciplines and specialties. The services have gone live and have provided excellent care to 2 patients who would have been forced to travel outside of the region and maybe be separated from their critically ill babies. Mickey is looking forward to serving many families in the years to come as this program grows. Thank you and congratulations, Mickey. Next is our Hero of the Year Health Equity Leadership Award, and the finalists are Angela Alston, The Ohio State University College of Nursing; Megan Combs, Metro Health Medical Center; Aaron Jones, Northside Regional Medical Center. And the winner is Angela Alston. Angela currently directs an inaugural Health Equity Scholars Program. It's designed to prepare students with advanced education and skills to guide the generation or implementation of evidence to improve health equity in our community. The program is designed to build a cadre of future diversity leaders who have the knowledge and the skills to improve health outcomes in diverse populations. It provides interprofessional, undergraduate, and graduate students across OSU with an opportunity to expand upon their knowledge and skills to improve health outcomes in diverse populations through the lens of equity and inclusion. This work is now engaged with a partnership with a local managed care organization, exemplifying the strong impact and the commitment to our community. Congratulations, Angela.
Thank you, Rob. Cincinnati Children's is pleased to support the March of Dimes Heroes in Action Awards by sponsoring the Health Equity category. This group includes nurses, physicians, and midwives. It is my great pleasure to announce from the Ohio State University College of Nursing, Angela Alston as the Health Equity Leadership Award winner. Angela is a clinical assistant professor and chief diversity officer at the Ohio State University College of Nursing. Angela directs an inaugural Health Equity Scholars Program, which was designed to prepare students with advanced education and skills to guide the generation or implementation of evidence to improve health equity in our community. This program's outcomes is designed to build a cadre of future diversity leaders who will have knowledge and skills to improve health outcomes in diverse populations. Angela also implemented a new training program specifically focused on biases that exist within undergraduate and graduate admission review processes. This training has resulted in an increase in the number of underrepresented students within the institution. Congratulations, Angela.
This brings us to our final award of today, the March of Dimes Roosevelt Mission Award, and here are the finalists. Nicole Sabatina, Fairfield Medical Center; Dr. Polly Train, Grand Lake Health System; Donna Bloomquist, Metro Health Medical System; Pamela Hetrick, University Hospitals Case Medical Center. And the award goes to Pamela Hetrick. Now, in Pamela's early years as a certified nurse, midwife, and the experience she gained from working in a socially and economically challenged population, it was clear that not only medical care and education were important to improving health outcomes, but we needed to have better social supports for the patients. Now, many of hers did not have adequate support at home in general. let alone during a pregnancy. So in 2010, Pamela and her team were able to open the doors at University Hospital's Case Medical Centering to the Centering Pregnancy Program. She quickly learned from the patients on just how impactful this program was for the community. Many group members became friends, improved their prenatal care compliance, which in turn helped drive down the rates of preterm births and low birth weight in a city that was deemed one of the highest infant mortality areas in the country. She and her team quickly identified the benefits of social supports and opened their doors with the support of family medicine to establishing a centering parenting program. University Hospital is one of the highest enrollees for centering pregnancy and has served over 3,000 families in the Cleveland area. That's incredible. Thank you, Pamela, for all that you have done to support moms and babies. You definitely embody this award. Thank you and congratulations to all our finalists and winners. I'm grateful and humbled by your generosity. The way you rallied to help fund research, education, advocacy, and programs to improve the health of every mom and baby. Your commitment to our shared vision of strengthening families by providing the support they need is something of which we can all be proud. Thank you, sponsors, donors, supporters, and thank you for being a part of this event and supporting March of Dimes. Have a happy and safe holiday. We look forward to seeing you next year at our next Heroes in Action Awards. Thank you.